So muscle dysfunction due to MI is acute heart failure. Okay, we're going to go over the heart failure a little bit more in a minute. The Frank-Starling mechanism. Nikki, do you know what that is? Can you remember anatomy?
My anatomy was 17 years ago.
It's been a while then. Anybody else?
I did talk about it like in one of the past semesters, but I don't remember exactly.
Okay. Anybody had anatomy recently, remember? Okay, so it was, if you remember, he used a rubber band, or maybe not lately with the online, so who knows. But the stroke volume of the heart increased in response to an increase in the volume of blood filling the heart. So everything else remains constant, so this is that stroke volume. We talked about the stroke volume at the beginning. Diastolic failure is when the left ventricle cannot relax, so it becomes stiff. So you may have heard some people say stiff heart. So the left ventricle cannot relax in between, it just gets stiff. So you can't pump what is not there. A stiff heart is often the cause of a woman's heart failure. So the heart contracts as it should, but too stiff again to relax normally. It requires a higher amount of pressure to fill the major pumping chamber. But this causes a higher pressure to back up into the lungs. So this is, again, the heart failure part that we're going to talk about. Hypertension, you guys learned all about that first semester, or you should know hypertension, the different things on that. Okay, so cardiomegaly, as it says in your lecture notes, caused by a number of different conditions. Could be disease of the heart muscle, the heart valves, hypertension, arrhythmias, pulmonary hypertension. So how we treat and the prognosis is what's the underlying cause. Is it the hypertension? So can we treat it with their medication? So what's going on? That's how we're going to treat it. So here's a picture of an enlarged heart. A lot of people do not even know they have this till they go to get an echo or get a test done and it shows this. So some may not have any problems at all, and again, they don't know. So that's cardiomegaly. Okay, cardiomyopathy, it can be acquired or hereditary. Acquired is passed on to you, acquired is you aren't born with it, but you develop it due to another disease, such as high blood pressure, obesity, thyroid, diabetes. So acquired, you develop it due to another disease. Hereditary is it's passed on to you from your parents. So I have the symptoms in there: breathlessness, swollen leg and feet, bloated belly, chest pain, syncope, exertion, fatigue. And there's 3 types of cardiomyopathy. We have the dilated. So this is severe damage to myocardial cells of the ventricles. Very poor prognosis with this one. And again, you're going to treat that underlying cause. What is causing this? Is it heart failure? Is it something else going on? Hypertrophic, the thickening of the heart's walls, that is congenital abnormalities. So a lot of times during infancy and adolescence is when they're going to find this. So we want to try to decrease that cardiac contractility, try to help it that way.
Sorry, you said the dilated was damage to what cells? I'm sorry.
Myocardial cells of the ventricles. And again, this is all in your readings, so don't forget to do your readings, because I just touch on a lot of this, but you should read what your reading numbers are. I know sometimes it's whole chapters. I wish I could write my own book because I hate how it goes back and forth. I could, but I'm not going to do that. Restrictive. The cause is usually unknown. Blood clots can form. I'm going to use diuretics with this. Okay. And I have a video to